So today's talk is called Bringing Lupus Nephritis Out of the Shadows. My name is Christopher Collins, and I'm a medical director at Aurinia Pharmaceuticals. Today, I'm here on behalf of Aurinia to talk about lupus nephritis. And the specific reason I'm here is because I've spent most of my career in this disease space. I spent the first 15 years of my career in academic medicine, running one of the largest lupus clinics in the Washington, D.C. metropolitan region, where I conducted research and trained fellows in the management of lupus and lupus nephritis. A few months ago, I accepted an opportunity to join Aurinia. Thus far, my experience has been incredibly rewarding. Let me tell you a little bit more about Aurinia. Aurinia is a late-stage clinical biopharmaceutical company focused on developing therapies in disease areas that have been historically challenging to address, like lupus nephritis. The corporation was initially known as Isotechnica Pharma and was founded in Victoria, British Columbia in 1993. 20 years later, it merged with Aurinia and subsequently focused on developing a compound for lupus nephritis. And this year, we submitted our compound to the FDA for approval. Around the same time, Aurinia opened its principal commercial hub in Rockville, Maryland, just outside of Washington, D.C. Today, we're going to talk about lupus nephritis. But before we do so, let's quickly talk about the root causes of the disease, lupus. Lupus is a serious, chronic disease with many complications. With lupus, another term we call it is systemic lupus erythematosus, SLE, the immune system attacks healthy cells of the body. Now, normally, your immune system is there to work on your behalf to fight off things like infections from viruses and bacteria and whatnot. But in autoimmune diseases, for which lupus is one, the system instead attacks your normal healthy tissue. Now, there are a lot of autoimmune diseases out there, type 1 diabetes, multiple sclerosis, and lupus. The difference is that those other diseases really focus on one specific target. But in lupus, you get targets that can range from all over the body. And when the immune system attacks healthy tissues, it drives what we call inflammation. And that inflammation is what results in the clinical manifestations that people with lupus have, as well as potentially causes damage to different parts of the body. This includes the joints, skin, brain, heart, lungs, and the kidney. And when it affects the kidney, it is a condition that we call lupus nephritis. It is felt that overall, about 50% of patients living with lupus are at risk of going on to develop at some point lupus nephritis. Now, lupus nephritis is a common complication of lupus that involves inflammation inside the kidney itself. And the big problem is that that inflammation causes permanent damage that we can't undo. And in fact, the damage results in a kidney that can no longer function to do properly what it's designed to do, which is remove waste from the blood and control amounts of fluid in the body. And this function is critical in human survival. In addition, lupus nephritis can cause serious health problems outside of just the kidney from the damage from the inflammation. It can cause kidney failure and some other things that we'll talk about in today's talk. So who's affected by lupus nephritis? And this is an actual patient who has lupus nephritis. Well, first, lupus nephritis is not as uncommon as you may think. It is estimated that upwards of 100,000 people currently living in the United States are living with lupus nephritis. When we look about who's at risk, about 1 in 3 people at the time of diagnosis already have lupus nephritis, suggesting a real unmet need and the need to find these people early. In addition, we have observations that tell us certain races and ethnic groups have higher rates of lupus nephritis than others. For example, compared to white people, the prevalence of lupus, which is how much of a disease is given in a given set of time, it's 4 times higher of people of African and Asian descent and almost 2 times higher for Hispanics and Native American peoples. We also know that while lupus nephritis is more common in women than men, men are actually more afflicted with severe disease. So what are some of the signs and symptoms of lupus nephritis? Well, some of the potential signs include swelling, generally seen in the legs, feet, or ankles. And this is a reflection of so much protein being spilled in the urine that the body lacks the balance it takes to keep all the fluid inside the blood vessels. And what tends to happen then, it kind of spreads into the spaces around the feet and ankles where gravity drives that process. And so patients with lupus nephritis will often complain of swelling in the feet, sometimes all the way up to the calves or even knees. We also have, from all that extra water, which is no longer being able to be processed by the healthy kidney, you get some weight gain. This is a different kind of weight gain than you get from eating a lot of, say, bad foods. This is weight gain that's all water weight. And generally, this is going to accumulate over a shorter period of time. And so we encourage patients to kind of track their weight and keep an eye on it. We also know that patients with lupus nephritis, especially active disease, have a lot of increased urination, especially at night. And what this is reflective of is those patients whom now have had all that extra fluid retention, especially in the legs and ankles from the being on their feet all day. When they go horizontal at night, it allows the kidney to not have to fight gravity as much. But the consequences is that it produces more urine. And so patients will often complain of having to suddenly start increasing the frequency of going to the bathroom at night 3, 4, 5 times, whereas normally you should only maybe have to go once or twice at most. And finally, one of the more unusual things that we have patients watch for is the phenomenon of having a frothy, bubbly, or foamy urine. And what that suggests is that when you pee into a toilet and you see a lot of froth become of that, it's generally because of an excessive amount of protein that normally isn't present. So it's difficult to identify lupus nephritis just by physical exam alone, or the symptoms really. So your doctor may also check for other signs of disease. These include blood tests, which we'll go over some more in depth. The first is called a urinalysis, and we look for something called proteinuria. This is measuring the amount of protein in the urine. We'll also actually look for microscopic amounts of blood in the urine as well. This is not anything you would ever see. We call it microscopic hematuria as opposed to gross hematuria because generally there's not enough blood to turn the urine any color. But under a microscope, we really shouldn't see any. But in lupus nephritis, in some patients, they'll have some measurable amounts of red blood cells, which is abnormal. We'll look in the bloodstream for abnormalities in electrolyte levels, especially things around potassium. And the kidney's responsible for regulating a lot of these things. And so when those levels go abnormal, it clues us in that maybe we can look to the kidney as a potential problem. Also in the bloodstream, we measure something called the glomerular filtration rate. This is a calculation that effectively tells us how healthy the kidney is, how well it's filtering the blood. We also look for something called a serum creatinine level, and I'll tell you more about that here in a little bit. We measure vital signs like blood pressure. The kidney is very important in monitoring your blood pressure overall. And then eventually we'll move to what's called a kidney biopsy, and that's where we look for things like inflammation and scar tissue. But we'll cover more of that here in a few minutes. So what are some of the complications related to lupus nephritis? Well, in addition to the signs and symptoms that I went over here just a few minutes ago, lupus nephritis may additionally cause an increase in blood pressure. As I stated a few minutes ago, the kidneys are an integral part of blood pressure management. There are cells within the kidney that can tell how much pressure there is and respond to it. And a healthy kidney is unable to make that regulation. And as a consequence, blood pressure can go up in many people and is a sign of poorly controlled kidney disease in a lot of patients. And the problem is that once you start having problems with inflammation of the kidney, you get some chronic kidney disease. I'm sorry, that's my dog. Ignore her. You get some chronic kidney disease, and this is some scar tissue that's inside the kidney as the kidney function declines, and they're intricately related. We also recognize that inflammation, not just in nephritis, but almost any systemic inflammatory disease, promotes certain cardiovascular complications. And this is due to inflammation in the lining of the blood vessels of the heart and the brain as well. And those promote early atherosclerosis and plaque formation. And so a lot of our patients who have a lot of, especially unchecked inflammation, have an increased risk of cardiovascular disease like heart attacks. And finally, if we never really get the inflammation under control, it results sometimes in what we call kidney failure. The other medical term, we call it end-stage renal disease. And unfortunately, that is the life of the kidney. We can't salvage it after that. And there's a big problem because you have to have your kidneys. And so patients who reach this point either have to end up going on dialysis or they have to get a kidney transplant. And so the concepts that we think about lupus nephritis is that we should catch it early. And this is because data has suggested that early diagnosis and treatment may help prevent irreversible kidney damage. Well, first of all, who diagnoses it? Well, I'm a rheumatologist. My background is in systemic autoimmune disease, especially things like lupus. And so I'm one of the people that are monitoring those background conditions which predispose patients for certain subsets of problems. And an example for this, it would be lupus, and I keep that eye out for patients to develop. So some of those earliest telltale signs are the things that a rheumatologist is going to pick up. And again, we specialize in a variety of diseases. Classically, it's a lot of things like arthritis and muscle diseases, but we also do autoimmune diseases like lupus. The other important clinician is a nephrologist. This is a kidney doctor. A nephrologist is somebody who specializes, again, in a lot of diseases, but mostly centered around the kidney. And there are some nephrologists who do specialize very much so in lupus nephritis specifically. But generally, it's both of us, right? And so there's a concert between the two of us that you're going back and forth, especially once the diagnosis is made, but also early on once even just a diagnosis is suspected. A rheumatologist may have an early suspicion based on some of the signs and symptoms or tests that we have mentioned and refer to a nephrologist who will be the one who confirms that diagnosis of lupus nephritis, generally through a kidney biopsy. So what are some of the tests that are used to help diagnose lupus nephritis? Well, we've mentioned some. The first and probably the most important is the urine test. It's simple, it's easy to do, and it's vital in detecting any problems with your kidneys and making sure that they're functioning well. One of the things that I said that we've looked for in these before is protein. So excessive protein, called proteinuria, is an abnormal manifestation. It's not unique to lupus nephritis. It occurs in other conditions like diabetes and others. But in a lupus patient, anyone with proteinuria that's abnormal gives us concern and makes us think that, well, maybe we need to do some additional tests to really understand what's going on. Many times, the initial screening test will just tell us if you have some, and then we'll look to quantify it, measuring it through what we call a urine to protein creatinine ratio. And that gives us a general idea of the quantity of protein being spilled in the urine. The urine analysis is also important at looking, as I said earlier, for blood in the urine. And again, this is never an amount of blood that you would see on your own with the naked eye, but you'd have to see it under the microscope. But even under a microscope, any small amount of blood is going to be important in determining and understanding what may be going on. Also, we talked about blood tests. One of the ones more commonly done is measurement of something called creatinine. So creatinine is a normal waste product that results from normal breakdown of muscles. And normally, the creatinine is filtered through the kidney, and that results in a fairly constant level, measurable level in the bloodstream. Now, there's a lot of caveats to this. Obviously, if you have a large muscle mass, if you're a big weightlifter, bodybuilder, you're going to have a lot more creatinine, which is within your normal limits, versus somebody whom is 75 pounds and very thin and doesn't have a lot of muscle mass. Their muscle creatinine level will be much, but normal for them. So we take these things in context. But when we get a blood level of creatinine that is abnormal, especially in the right clinical context, we think that there's something that maybe is making the kidney not work as well. And finally, the kidney biopsy. This is what we call in medicine the gold standard. The gold standard is a test or diagnostic tool which is the primary way we feel it is important to make these diagnoses. Generally, it's done as an outpatient procedure. They put a small needle into the back, into the kidney, and get some tissue, and then it's sent to various amounts of different types of microscopes to understand what's really going on inside. And it's important to do so because there's a lot of things that can happen to a kidney. But it's also important to understand if it's because of lupus, what kind of kidney involvement is really going on and what's the extent of the inflammation and damage so we have a better idea of how to treat it. And again, a nephrologist and rheumatologist will work in concert to organize that process. Once you get a potential diagnosis of lupus nephritis and you undergo a kidney biopsy, this is where we then go to the microscope and we go to our pathology colleagues to really determine the kind of lupus nephritis that you have and what effect that has had on the kidney thus far. Listed here are 5 or 6 different diagrams that show the spectrum of what lupus nephritis can look like in an individual. Now, the first thing I'll tell you is while they're called classes 1 through 6, they are not intended to be in order of severity. They are just given as numbers, and then the names are a little bit more telling and important in how we think about that. So class 1, this is effectively a near healthy kidney, and very rarely do people with class 1 even get a biopsy because they have very little abnormalities which would warrant a biopsy. And conversely, class 6, indeed, it has the highest number, and it represents end-stage kidney disease. We very rarely biopsy these because most of the time patients have lost all renal function, and we know there's not going to be much utility in it. And the other parts are the ones that are more the ones that we feel are important to treat, especially class 3, 4, and 5. Now, class 3 and 4 clinically are probably the most important. We call these the proliferative lesions. And these are the lesions which have the highest amount of inflammation and thus the highest amounts of potential for scar tissue formation and development of kidney failure. The difference between class 3 and 4 is really just the degree of involvement of the kidney. So class 3, less than half of the kidneys involved. Class 4, half or more is involved. And we really got to get a sense then of how much chronicity activity is going on by looking under a microscope. Now, class 5 is very different. It's by no means worse than class 4. It's just different. We call it membranous glomerulonephritis. And this is not nearly as inflammatory as 3 and 4 are, but it is characterized by a lot more proteinuria. And so when we look under a scope, we see a very different picture. And indeed, we think about treating it a little bit differently. But it is just one of the various reasons that we are doing a biopsy, because all these things and all these moving pieces are important understanding how to best help you manage your care. So let's move on to the management of lupus nephritis. Step in managing lupus nephritis by being here today to learn. This community is full of support and resources to help people living with lupus nephritis. And taking an active role in your condition can help you manage it better. And so how do we do that? And we're going to go over all of these individually in the upcoming slide. But working with your healthcare providers, this is how to engage in that conversation. And I'll give you some kind of tips and guidance that can help really make that conversation rewarding experience and work best for you. Learning about your disease. And I always tell my patients, there's power in education. The more you understand, the more you learn, the better you'll be an advocate for what's going on. We'll spend a little bit of time talking about some diet and exercise that can be very beneficial to how your healthcare does overall, and then some general tips on a healthy living lifestyle. Well, who are the potential members of your lupus and lupus nephritis healthcare team? Living with lupus and lupus nephritis can mean having to see a lot of different healthcare providers for various needs. And these are just some of the specialists that people living with lupus nephritis commonly interact with. So first of all, there's rheumatologists like myself. We're often the initial gatekeepers for patients already with a diagnosis with lupus. And we're the ones that are running those blood tests and getting the urine samples and screening, especially at high-risk individuals, patients, and making sure that we catch lupus nephritis early and understand what's going on at the earliest possible time. And then once a suspicion of lupus nephritis is made, we generally start bringing in our kidney colleagues, the nephrologists, and these are the ones that really do specialize in kidney health. They're the ones who often are responsible for getting our kidney biopsies, and we try as much as possible to work in coordination to help best manage your care. But that's not all. There's also, of course, your primary care provider. They're the ones out there helping, making sure that all the other aspects of your health are monitored and well controlled. We talked about cardiovascular risk. The primary care provider is going to be there to make sure that if you have high lipids, that they're looked at and whatnot. And so they're an integral part, and we loop them in as much as possible as well. Some patients really appreciate the utilization of a psychologist. Living with lupus, it's tough. Lupus nephritis, it's just as tough, if not tougher. And so having some backup and somebody to help kind of understand and talk to and be that neutral third party has been very beneficial for many of my patients. There's also the dietitian and nutritionist, and we'll talk about some of the dietary tips later on, but it's sometimes overwhelming to have to figure out all this on your own. So we bring in the diet nutritionist to really walk you through what's an ideal diet for somebody on certain kinds of medications or somebody living with lupus nephritis, and they're an invaluable tool to your health. Additional healthcare providers that may be need but not limited to include people like a dermatologist. If your lupus has a lot of skin manifestations, if you get a lot of rashes, we generally have them involved, absolutely. If you've got a lot of neurologic manifestations, you'll often have a neurologist on board. Again, bringing back the loop into the cardiologist or even some of the lupus manifestations of cardiac disease, we'll have a cardiologist on board. That pathologist is there to help us read and look through some of the pathology that we get in various biopsies. The radiologist similarly is there to help us understand some of the imaging that we get over time. The pharmacist is your friend. They help you answer those questions you have about the medications you're taking. Do they interact with anything else? What are potentials for side effects? Should I be concerned about anything else? And finally, a physical therapist. Physical therapist is there to help you understand what's the best kind of movements and exercises and, how to best really keep your body healthy through this process. And I know there's a ton of people on here. Nobody has time to go to all these people. And I'm not way in any suggestion that you have to go and have all of them. But don't be surprised if you do have a cluster of them for sure. So one of the best ways to track and take control of your care and manage your condition is by keeping track. Keeping track of things like appointments, symptoms, lab tests, and your medication. It can be helpful to bring someone along to your appointments so they can take notes, ask questions, and provide that moral support. And don't be afraid to speak up and tell your healthcare provider what's on your mind. It can be really helpful to bring also questions you've thought ahead of time. And on the next slide, we'll talk a little bit about how we think about telemedicine in these times of COVID. But I always tell my patients, you're your own best advocate. Plan ahead. Think about what is really you're going to want to talk about and prioritize it, whether or not it's in person or through telemedicine. You may have a list of 100 different things that you want to cover in your visit, and you're not going to have time to do it. So pick the ones that are the most important. Be upfront. When your clinician, you've done your greeting to say, I would love to make sure we carve out a little bit of time to discuss a few things that I think are important for me to know about and understand. Make sure that if you're tracking, that you're not just tracking the last couple of days. When we see patients in the clinic, we're trying to get a better understanding of how things have been since we saw you last overall, not just how things were this morning when you woke up. And a tracker really can help you understand that better. Track pain, track all sorts of things. And there's all sorts of tools out there to look at that. And then have that family member, I think, is very important as well. So what are some additional telemedicine tips? And I know a lot of us are having to go through telemedicine with our clinicians these days because of the COVID situation out there. And so the way I tell my patients is be prepared. First of all, have those questions written down in front of you at the time you go for your doctor visit online. Second, ensure that you have a reliable internet connection. Unfortunately, there's a lot of people fighting for the same internet bandwidth in your house sometimes. And so maybe you want to try to either make sure that you're the only one and that you kick the kids off Netflix and that you have a reliable internet connection that won't get interrupted, because it's going to be hard to reschedule if you have your call dropped and you spend half the visit trying to reconnect. Some use the chat feature in a telehealth visit. If your physician's going off and running some conversation and you want to make sure you get something but you don't feel you want to interrupt them, it's okay to use the chat feature. Next, because the clinician's not in the room with you to do a physical exam, you're going to probably be asked to show some certain manifestations. For example, we talked about lower extremity swelling and edema. Well, if you have really tight-fitting clothes, you're not going to be able to lift your leg and show whether or not you leave a thumbprint if you push on your shin. But a clinician's going to want to ask you to do this because it's part of that exam finding to know if you have some of that lower extremity swelling. And so wear appropriate loose clothing that you can get and move around and show them a skin rash if you have a problem or whatnot. And then finally, if you can, ahead of time, try to get everyone has a blood pressure cuff, but if you get access to one, take your blood pressure before your visit. Same thing for your temperature and measure your pulse. Maybe if you have a scale, you can get your height and weight and report all this to them. And that way you don't spend that valuable time that you have in front of your doctor trying to get those measurements, because they're going to want to have them. So what are some of the commonly used treatments for lupus nephritis? Well, currently, there are no medications approved by the U.S. Food and Drug Administration, or the FDA, for the treatment specifically of lupus nephritis. Nonetheless, we choose and prescribe treatments all the time that are approved for other conditions, and they generally fall into these categories. So the first and arguably the most important are the immunosuppressants. This is a category of drug that, by definition, suppresses your immune system, and because that's part of that driving process is what's going on in your kidney. And so by lowering the immune system down to a more reasonable level, we can suppress some of that overactive immune response. And that is really important, especially in diseases like lupus nephritis, which is a very severe consequence of unchecked inflammation and immune-mediated damage. The second is steroids. These are the drugs that are unfortunately a necessary evil for most patients. And if you are on this call and you have a diagnosis of lupus, the likelihood is you've seen some of these drugs before. This is really no different. All the current guidelines still highlight the importance of steroids, and that work quickly. And when we talk about treating lupus nephritis, it's really getting the inflammation down under control as quickly as possible. Because more time you spend with inflammation that you can't control, the likelier it is that you're going to have damage which you can't reverse. And steroids are absolutely part of that upfront initial treatment protocol. Now, most of us are trying to use less than we were using before, and I think that's great news for all our patients. But unfortunately, almost everyone ends up on some. Moving beyond the immunosuppressants and steroids, there are some additional medicine categories which are helping to help support that kidney health. The first is blood pressure medications. So one of the problems with having uncontrolled high blood pressure is you're putting high amount of volume to the kidneys when they're in a weakened state, and that actually can contribute to damage. And so there's an importance on proper blood pressure management. And this is where we work a lot with primary care and the nephrologist to help making sure you're on the right kind and the right dose of these medications. And the last is antimalarials. Again, if you're on this call and you've had a diagnosis of lupus, the likelihood is you've heard this or you're already on them. And antimalarials, we've been using them for decades, have been proven very effective in helping control the symptoms and flare rates of patients with lupus. But also it's been shown to be very beneficial in the treatment of lupus nephritis. Well, let's move beyond medication to some of those other bullet points I mentioned earlier. So the first is that while medications absolutely are vital, certain lifestyle choices about what you eat and how often you exercise can help with the management and living of patients with lupus nephritis. So first of all, there are certain dietary suggestions that we'll have for you. Once your kidneys are inflamed and are affected, we generally want to make sure that we have diets with less sodium and salt in general, because salt contributes to high blood pressure, and we want to keep that blood pressure under control so we're not contributing to the damage of kidneys. And so if you're a big salt user, there are salt substitutes that can be considered, but in general, just try to stay or use much less of it, and you can get a better control of the blood pressure. Second, avoid over-processed foods. When I say processed, these are like highly enriched products like white bread and white rice, things that are high in preservatives. The more you process food, the more it steers away from the kind of foods our body was intended to deal with naturally, and that has to work harder to manage. In many cases, those processed foods can drive an inflammatory process. I generally used to tell my patients that if you look at a product label and you can't pronounce a third to half of the things on it, it probably wasn't meant for consumption, and maybe look for something a little more fresh or natural. Also, when you have a lot of protein spillage in the kidney, it's working pretty hard to try to hold on to what it has. And so minimizing high protein meals or taking smaller portions of those protein-rich foods like the chicken and fish and red meat is going to make your kidney a little bit less stressed. And thus is a probably better healthy situation for your kidney in general. So really optimize those fruits and vegetables and heart-healthy foods and eat smaller portions of the high-protein content. Obviously, be sure to talk to your doctor before making any changes to your diet. Additionally, consider adding exercise to your routine. Exercise can have many emotional and physical benefits. It can help reduce stress and strengthen parts of the body that lupus and lupus nephritis affects. Absolutely, it strengthens bones and muscles, but you want to do so without aggravating that inflamed joint. And you can do this mostly through low-impact exercise. Some examples of low-impact activities include walking, swimming, yoga, and an elliptical machine. Now, if you're a runner and you're used to running, you've got good form, nobody's going to tell you have to stop running. But if you've never ran before, that's fairly high impact on your knees. And for goodness sake, don't go join a rugby team right now. That's a little too high of impact for anybody. The other thing I get a lot about was like, well, how do I get started in all this? Or maybe I'm doing some walking. How do I increase the amount of exercise that I'm able to do? And my advice is always just, be smart about your concepts and goal setting and make it sure it's achievable and it's pertinent to you. And then you build yourself up to it. Say you want to start walking. Well, start walking just 5 or 10 minutes every other day. And once you've gotten that a little bit better after a week, you can build that to maybe every day. And then you start building incrementally on the amount of time or the distance or the pace that you're walking. And sure enough, in a month or so, you're walking 20 every day and you're feeling better for it. And again, like the diet, every individual is unique. You're going to have your own specific needs and sets. So consult your doctor before starting any new specific exercise program. Remember, you are your own best advocate. There's strength in community, and we have at Aurinia some programs that we'd like to tell you a little bit more about. But first, let me tell you a summary of what we've talked about thus far. First, be engaged and stay informed every step of the way. You want to learn about lupus nephritis and lean on your healthcare team. As I mentioned earlier, understand your risk. It's estimated that upwards of 50% of patients living with lupus are at risk and may go on to develop lupus nephritis. Know what to look for. We've talked about some of these today. But beyond just the physical symptoms, like I mentioned, the lower extremity swelling, the high blood pressure, the things like foamy urine, you're going to want to make sure that you're an advocate and help remind your clinician that there's an importance in routine testing to screen you for lupus nephritis. So talk to your doctor about these tests and when they're done, what the results mean. Next, discuss your options. In lupus and lupus nephritis, there is no one-size-fits-all treatment. You and your care team will decide what's best for you. And finally, continue to learn. Engage with all in, and I'll tell you what that here is in just a second, and the lupus nephritis community to receive more information about lupus nephritis. It can also be helpful to see what your peers are saying about their own journey with lupus and lupus nephritis, and you lean on each other for support. So join the All In community. So All In can help you feel informed and support through every step of the way. So there's a website developed by Aurinia called allinforlupusnephritis.com. The All In website offers all the information we've talked about today and even more to allow you to learn more about lupus and lupus nephritis. There's a Facebook page at facebook.com/allinforln where you can get some additional information. And there you can connect with others dealing with the same problem. Finally, you can sign up for the Lupus Nephritis Awareness Kit. It's a kit that comes straight to your door, full of helpful lupus nephritis resources, like doctor discussion guides and a glossary of terms, many of which we've discussed today. For lupus nephritis website. This is brought to you by Aurinia, and together we can raise awareness and offer support. There is strength in community. I'd like to thank everyone at the Lupus Foundation North Carolina group, and it's been a real pleasure to talk to you this afternoon.
Hello, and thank you to the North Carolina chapter of the LFA for allowing Aurinia to share a few words on our company. At Aurinia, our mission is to transform people's lives by delivering therapeutics that change the course of autoimmune disease. Our engagement with the lupus and lupus nephritis communities is at the center of everything that we do.
It has been estimated that up to half of people with lupus may experience kidney damage or lupus nephritis as a consequence of their disease, and over time it can become life-threatening. Aurinia is diligently working to help those people by translating decades of research into a potentially first therapy for lupus nephritis.
We are doing our part to spread awareness of lupus nephritis because many people don't yet know they have the illness or that they could treat it better. Lupus nephritis can go undetected for a long time, but as many of you know, it has serious consequences. So getting diagnosed and treated early is very important for long-term kidney health.
This is why events like this are so important to keep our momentum up as a community, bring us together to share stories and learn from each other and advocate for needed resources.
Aurinia believes the lack of approved treatment options has kept lupus nephritis in the shadows, and we are committed to shining a light on the distinct needs and unique experiences of people with lupus nephritis.
As part of this work, Aurinia has created a disease awareness program called All In for Lupus Nephritis, which has a website at allinforln.com.
The All In website provides information about the signs, symptoms of lupus nephritis. It also aims to demystify the processes of diagnosis and management and share experiences from others living with the condition, including personal video testimonials.
We hope to promote early diagnosis and better management of lupus nephritis to get people into remission and help them to live longer, better lives. Together, we can change the course of autoimmune diseases like lupus. So thank you again for your time today. We are proud to learn alongside you at the summit, and we hope you all have a wonderful day.